Welcome to the Extraordinary Health Podcast. I am Allie. We also have Allie B today, and we're also here with your host, Dr. Paul Beckham. And today we're going to be talking about season changes and how it affects your body in the different various ways and how you can deal with that.
So, the one thing we were kind of talking about in the office is how when the seasons change, people start to notice different things. And especially when you get around times where, like lately, we had some storms roll through, and I just had a lot of patients coming in with achy joints. And some people think, oh, is that a wives' tale? Do I personally see it consistently in patients? Yes and no. When there's a big change, from a high pressure cell outside where it's nice and sunshiny to a low pressure cell coming through, a lot of people, yes, are going to start to feel it in their joints because there's less pressure. And then if they have joints that are already arthritic, maybe a little bit inflamed, there's just more room for inflammation to get into the joint, and they're going to feel more pressure there then. So I know that's one of the things, that we'll kind of see here. I've also kind of seen it in the opposite direction too. People, if it kind of goes from a low pressure cell and all of a sudden it's a quick high pressure cell, people still get the same issues kind of going on there. Not quite as drastic, but people will have some achy joints with that as well. So anytime there's a drastic change in barometric pressure can cause some issues with joints. So Allie's been a massage therapist, and I'm sure she's seen some patients that have had or come in with headaches with seasonal changes.
For sure.
Too.
Yeah, and pretty intense ones as well, like more than just the average headache. Another thing that I do also see is joints, knees, elbows, even ankle joints, people talking about swelling changes and things like that. And I never did have a barometric pressure barometer anywhere in my practice, but that would be interesting to kind of see, and then you can see it in real time what the differences are. But I always used to joke too that I could feel it in my knees when we were going to get a big storm, and I always thought it was an old wives' tale, and I thought it was silly, but I really could. I really could. I've been pretty hard on my knees over the course of my years on Earth, and I can feel it in my knees when we've got season changes and pressure changes for sure. Yeah. And that's all I got about that. I do think it's funny though that we're talking about season changes right now because it feels like the season will not change. It will not end. It's not changing. I don't believe it. I'm not buying it. I'll believe it when I see it.
So that's what I said. I have a whole new slogan you can put on North Dakota license plates.
What's that?
Endless winter.
Oh God, it's so appropriate. That's so appropriate. I wish it wasn't, but it's so true.
When that one summer day comes along, you know what comes next?
Fall immediately?
Winter.
1 week after summer is fall, and then a week later is winter.
Winter.
Yep. Gosh, yeah.
But the other things that kind of happen, especially this time of year, maybe in the seasons kind of coming up, are patients that'll start to develop things like migraines. Where you're starting to get some of that vascular aspect there. Although I tend to look at patients when they do have headaches on a spectrum where there's a small fraction of people that will have purely migraine headaches, and there's some patients that will have purely muscle tension headaches. But it's kind of like a bell-shaped curve in that most people have a mixture of both. And a lot of times if we can get rid of the muscle tension aspect, which is what doing chiropractic work can help with, some muscle work, even some of the therapies that we have in the office were really great at, decreasing that muscle tension and getting rid of that inflammation. But if there's that little bit of vascular aspect left there, that's where we can maybe get into some nutritional supplements. But if it's bad enough, we might need to start to look at, run some blood tests to see if there's even some, different types of sensitivities going on, whether it be airborne things or things that people are ingesting, to make sure that those aren't setting off that migraine aspect of the headache there. And, definitely the seasonal changes, once you get pollens and dust and dirt and the farmers get out in the fields, which who knows when that's going to be this year. You get all that up in the air as well. even some of the chemicals that they maybe have, put down on the fields. If the fields end up being dry, which I kind of doubt that this year,
Might be a safe bet.
you might have some of that stuff getting up into the air, and people can have some sensitivities to those things that they're just breathing in on a daily basis. So,
And along with those pressure changes that relate to those vascular different issues, always this time of the year as well, dehydration becomes a factor. And when it comes to like swelling and inflammation, you got to clear that stuff out of your system. And the best way to do that is to increase your intra and extracellular water.
yeah.
How would someone improve their intra
Extracellular water.
Yeah,
So,
You probably don't want to increase the extracellular water.
Just the
You probably do wanna
intracellular
increase
water.
the
Yeah.
intracellular
So,
water.
I mean, just hydrating, obviously, drinking water, staying away from like the more sugary or drying out beverages like coffee, but also electrolytes are going to go a long way in getting that water where you want it within your system. I know that haven't you been doing some more research on this recently? And you said that there was some other kind of supplement. What was that?
Yep, and I just happened to come across it. I mean, I was looking at more help for our patients that have neuropathy because 98, 99% of them actually have decreased intracellular water. So I just happened to be going through some research here, and actually it was a video I was watching, and the medical physician in there stated that she'd been helping out patients that had decreased intracellular water by using creatine. It's a supplement that weightlifters will use, and it just helps to increase that intracellular water. So I have just started to add that in for patients that have neuropathy going on to help increase that intracellular water, so they get better nerve conduction and better blood flow and all that to their tissues, which is what they're really struggling
I'm
with.
going to try that. I'm going to be so hydrated and buff.
They'll get more water in those muscles. They look big
Get
and
that
muscular.
creatine.
So if someone say they needed to up their electrolytes, what are different ways they could do that? Like, what could they drink? Because a lot of people hear electrolytes and think Gatorade, but Gatorade
Sure.
has a lot of sugar in it. So what would be something else you could suggest? Like, say they're on their way to work, they stop at a gas station, they're like, I think I need some. I feel dehydrated. What should they go and grab?
I would go with, they have Gatorade Zero, they have Powerade Zero, where they don't have the sugars in there. Obviously, you're still getting some of the dyes or whatever that they might color the things with. There's a lot of other electrolyte drinks out there, too. Simple things, you're talking about driving or something like that. Those are the things you can probably pick up in a store. Even at home, simple things to do. It's just, you don't need a lot of extra salt. It's just salt that you need. But use like sea salt or Himalayan pink salt, and just like a quarter teaspoon of it. You can spread that over your food, or just add a little extra salt to your food when you're eating it. Don't go crazy with it.
Now watch that blood pressure.
Yeah, you got to watch the blood pressure there. But a lot of people, they become overly obsessed with decreasing their salt intake. I've seen some patients that are in nursing homes that, good gravy, just talk to your physician. You need to have a little bit of salt here because you're so dehydrated that's causing a lot of issues for yourself here, because you have no way of those nerves conducting the proper electrical signal on them when you don't have enough water or fluid, and especially the electrolytes in there.
There's a big difference between a low sodium diet and a no sodium diet. A big difference.
Mm-hmm.
I know that for me, when I'm feeling dehydrated and I'm stopping at a convenience store, so I am actually allergic to Gatorade and Powerade because they use a modified wheat starch, and I'm celiac, so I can't have that. Makes me sick. But there are some newer ones that have no sugar. I know that you can find some of them locally, but also I'll just go for a bottle of water that's labeled with electrolytes. Just a plain bottle of water that says plus electrolytes. Yeah.
Spring water.
Smart water, whatever.
What about like coconut waters and aloe water and stuff like that?
You're going to get some electrolytes from those too. All those like fruits or nuts, however. I don't even know how coconut's really classified as there, but
I was going to say, I think it's considered a tree fruit, but looks like a nut.
Yeah. They call it a coconut.
But coconut water, I would
deceiving.
choose over like an aloe water for sure. But you got to be careful about the different other things that they put in that stuff too. So just check your labels.
Or even simple things like pickles, olives, have, sodium in them as well. So, a lot of patients when they're pregnant, they call it picophagia. They actually are craving the minerals. I mean, so if you want to find some healthy things to eat, that are, I don't want to say loaded, but they have, sodium or salts in them more naturally, or because they're pickled or brined or something like that, that's going to probably help cut that craving down. So,
Yeah, I can attest to that. I'm 7.5 months pregnant, and I drink so much pickle juice. It's probably not healthy, but it tastes
That's
so
what I
good.
do at home when I'm feeling dehydrated. Like I take literally just a
Yeah.
couple, like an ounce of pickle juice. A
shot.
shot. That's exactly what it is a shot of pickle juice, and then I'll drink a glass of water. That's what I do on the weekends when I'm at home. And it's not only do I love the taste, but it works really effectively and pretty quickly. So, yeah.
So, I mean, besides that, I mean, there's a lot of other things. I mean, people might think of, even at this time of year, you can start to notice your skin getting really super dry. I mean,
I was literally just
as
staring at
everybody's
my
covering
dry
up their
hands.
hands. People, even if, dehydration, you can start to look at, and you can even measure it in yourself. Pull the skin on the backside of your hand up and just see how long it takes for it to snap back to where it should be out there. That's a simple way of kind of measuring how dehydrated a person is, and everybody in the room here.
On a
is
related
shocked.
note, I'm going to be drinking a bit of water after this.
Mine's not as bad as I thought. I just feel dehydrated. Forever thirsty.
So that's a simple way to just kind of check and see, how dehydrated you are. We do have equipment in the office that we do use in testing things like neuropathy or other types of nervous system problems, and it happens to measure your water levels in your body as far as your hydration level, your inter and extracellular water levels there, so we can kind of know where you're at, and then we can kind of guide you into some of the different things that might help you here too.
So let's touch back a little bit on like the vaso differences in the pressure and the changes in the seasons and the storms and things. What would you recommend for somebody that's experiencing, say, migraine headaches with that? As far as what we offer in the office,
With that?
yeah.
I mean, a lot of times it's just kind of come in and get evaluated, and we're going to just see if you do have a muscular kind of component with that. I mean, a lot of people, do have a muscular component, especially up in the base of the skull, in the suboccipital region there. And you have obviously your blood vessels that run through that area there too. And if we can get those calmed down, that can be super helpful. Migraine, even a supplement that people might want to seek out themselves here. It's one of the only ones in Europe that they use as a preventative, is Feverfew. That's just a good supplement that will help prevent migraines. Probably if you know that you're, going to possibly have migraines, or you do have migraines on a regular basis, getting some Feverfew and starting to take that as a preventative can be very helpful. It's not going to probably abort or stop a migraine headache, but long term, if you want to have something that's going to be very inexpensive, it's just an herb. I think you can even get it in some tea forms if you like, and that could be just a very good thing to help stop the migraines. Other things in the office, I mean, we have lots of other therapies, especially like the laser therapy is very, very helpful with vascular things. It helps decrease pain and inflammation. That can calm down a migraine headache rather well. Might not take it away right away that first day of treatment there, but it'll knock it down very quickly if people come in a pretty tight fashion as far as for visits. PEMF therapy that we have is also another one that's very, very good at putting a charge on your body's cells. It was originally intended for helping to heal diabetic ulcers on a patient's feet. We use it a lot with our neuropathy patients because of that situation there. We want to help improve the blood flow through their entire body. But the same thing with the migraine there. We can actually kind of isolate it out to like your head and neck region, and make sure we're running it right through there where you're having some of the issues with the migraine headache, and it typically will help kind of calm you down. And a lot of patients will notice a significant reduction in pain symptoms, after using the PEMF therapy. So
So what I'm noticing, the word that it's sticking out to me the most as you're explaining all these things is inflammation. And that laser does wonders on inflammation. So
Yep.
yeah, that's and another reason to stay hydrated because of that inflammation for sure.
And natural anti-inflammatories. If a person wants to get into some different supplements, looking at it from a functional medicine standpoint, you can get into like turmeric, which it's curcumin is the active ingredient there. That's a good one for inflammation in the body, whether you have arthritis going on, migraines, most of the things that people have going on musculoskeletal wise, where they're having pain problems and inflammation. That's where that curcumin can be very, very helpful in reducing that. Sometimes ginger can be a help there as well. There's natural. You can get like a natural anti-anxiolytic supplement there, valerian root. It smells nasty, so don't smell it very much. But once you put it in your mouth and swallow it, it doesn't taste bad or anything like that, and it's not going to give you the bad breath that's going to smell like it smells like old musty
I've
socks.
smelled it before. It's
kind
not
of
a
a nasty
good
smell.
look.
But it's a very, very good one for helping reduce muscle tension in cases where people might have a little bit of dehydration going on. Once that kind of gets out there, because you're going to want to drink it with some water here, but it'll help just kind of calm that stuff down, and you'll have less issues with like muscle tension, headaches, or even if you've had strained some muscles, working in the garden or playing sports. That's a very good supplement to have on hand to help deal with that.
So what are some foods we've covered like adding some anti-inflammatory foods, but what are some foods that people should cut out that cause inflammation besides the big one, the sugar, right? Sugar is probably the biggest.
All the white things, generally, look at all the white foods, it's going to be white sugar, white flour, even, white potatoes, even white rice, all those things typically are higher in sugar content, which is going to sugar causes inflammation in your body. So not that sugar's bad, but if you get too much of it, that's where you end up having a lot of problems. I mean, especially when you start to look at, diabetic patients that don't take care of their blood sugar levels very well, that's where they end up having the vascular problems and nerve problems, again, like what we see with the neuropathy and all that. Also, all the internal organ issues that they're going to run into because of having, blood sugar levels just run way too high. And, literally getting those back under control is going to help reduce the inflammation a person has in their body. And I think even the brain gets affected by that as well. And again, that's where some of the therapies in the office can be super helpful here, because, we can use PEMF therapy, and that'll actually even help decrease, or it's going to help increase the blood flow in your brain and all that sort of stuff, and decrease the inflammation as well. So even patients that have issues with other kind of neurological type problems can be helped with that as well. So concussions, migraines, even patients with Alzheimer's, that's really, they're calling that like diabetes type 3, where you're getting too much blood sugar and it's actually affecting the brain, and your brain's just not able to clear it out really well. So
what if someone is just really wanting some like sweet or sugar of some type? What would you say? Like, well, replace whatever sweet thing you're wanting with this versus like
what are some
more
good
natural
replacements?
sugars?
Yeah.
I would just say fruits in general. Again, you just don't want to have too many of them, but I think if people are eating things like an apple, I mean, it's really high in fiber too, so it's going to kind of make you feel full. You're going to get that sweet taste in your mouth and all that. That's going to be a better solution. Bananas have a lot of minerals in them as well, so that could be a helpful thing there. Cherries, I mean, any of the fruits are going to give you that sweet taste, and people just need to get to the point where it's like, okay, I just need to use it to get over the craving, maybe take that time to chew it just a little bit more so that you leave that sweet taste in your mouth and all that, so that you're still calming that craving down, but you're still also getting some sugar in there.
One of my favorite old snacks was I would take blueberries, put them in the freezer for a couple hours, take them out when I'm like on my way to work or whatever, and just have them sitting out. And so they're kind of half frozen when I eat them. Perfect. They're perfect. And they have antioxidants, they have fiber, all of that. And they're, I mean, depending on what time of the year, or if they're ripe when you buy them, or if they're frozen when you buy them. I mean, I like to buy them fresh and then freeze them. They're so good. And it tastes sweeter for some reason when they're frozen. I don't know if it's psychological or what. Yeah, but to me, they taste sweeter when they're like half frozen, because they're more like candy that way. Yeah.
And they're good for your brain.
Like, another thing that people might think that, okay, wait a second here. They're going to go, wait. But one thing that a person could have, and it might not be on the sweet end of the spectrum, but people tend to crave chocolate. But a really good dark chocolate, I mean, I'm talking you're getting up there probably in that 90+% cocoa range there. Usually the carbohydrates are really, really low there. I would caution people that have migraine headaches to eating it, because a lot of times that is one of the triggers for migraine headaches is the cocoa. So if you know they have migraine headaches, just take this with a bit of caution here and make sure that, chocolate isn't one of the things that's going to be triggering your migraines there. So, but that could be something that, hey, people are craving it, and you just need to have even a small piece of that, and you wouldn't believe how much that helps to just satisfy a sweet tooth, even though it doesn't really have a lot of sugar in it. So,
and circling back to talking about joint pain, what, besides like taking the stuff to help with like inflammation, what else would you suggest? Say like if they just woke up and it's like, wow, my knees really hurt today. What would you suggest what's something that they could do that maybe could give them some sort of relief without taking like an ibuprofen or something?
Well, I mean, we get into a bunch of different things. It depends on how much time a person would have at that point. I mean, you could obviously do things like an Epsom salt bath. It could be very, very helpful. It's a magnesium salt. The magnesium tends to help improve blood flow. That can help decrease, some of the symptoms there. Obviously, there's things like topical analgesics that you could use, that you could, rub on your knees. Some of them are better than others, or people like them a little bit more. I've had patients in the past, oh my gosh, it's that Blue Emu stuff that works the best. And I get some of them, it's just the carrier. Some of them anymore, it's the CBD, based ones, which, yeah, you have cannabinoid systems in your brain there that I think CBD, if you were to probably take it orally, is probably a bit better. I don't know. I guess the research that I've seen, it was, again, looking at things for people with neuropathy, and the CBD kind of topical analgesics really didn't make a difference for them. I mean, it was pretty much the same as a placebo that they used. So I think it's the psychological effect. So if you feel like you feel better with it, go ahead and do it.
There's nothing wrong with the placebo effect. Not at
No,
all. If it
nothing.
helps, do it. Absolutely. My favorite thing is just an ice pack. If I've got a lot of swelling going on and it's brand new, it's fresh, it's what we would call acute, I just throw an ice pack on there. Yeah. It's free. Got one in the freezer. Don't have to spend any extra money on it or anything like that.
Well, same thing even with the Epsom salt bath there. I mean, especially if a person has like some arthritic knees, I guess that's what makes me think of it when they wake up in the morning and they try and stand down. It's like, ooh, they've been laying down all night long. They've had that whole time for fluid to slowly kind of accumulate in there. And then they go to try and stand up and they're just like, I don't know if I can do this, or ankles or feet or whatever it happens to be. So a lot of times it's even getting up and just start to move, get a little bit of movement there. Hopefully you don't have to go up and down stairs if your ankles or knees or hips are bothering you there, but try and walk around the house or something like that to just get things moving. Start to do some circles with the ankles, get those knees bending a little bit, even if you just got to be standing up and swing the legs back and forth, whatever you have to do. Movement is, motion is lotion. I mean, it's probably what it even gets down to there. So the more that we can keep things moving the way they normally should move. In the office, we're looking at structural alignment, making sure we get that taken care of. That usually happens after we get, the pain and inflammation to go down. And then we want to functionally get things to kind of work better after that. So we always want to get pain and inflammation to go away. And then if a person, that's why we'll give people exercises for home as well. It's like, here's some exercises you can do from some of the testing that we did in the office here to make sure that we're giving them something that they can help in correcting their problem themselves. And then long term, we just want to make sure then we're strengthening that stuff back up so they don't have the problem come back again.
So basically, if you are having any struggles with the season change, talk to Mother Nature. If you're having some struggles with the season change effects on your body, call us. Does that sound fair?
Call on the sun to shine on all this lovely snow.
Just not all at once. We don't need the flooding.
Melt it slowly, yes. We don't want to have anything melt like overnight here. That would be a nightmare. But let's get into spring here. Let's actually have 4 seasons and not just 2.
And not just water everywhere, because Fargo's flat.
Well, hopefully next time you hear from us, we've got a little bit more sunshine and
a lot less snow.
We're not talking about loading up the ark.
We're not gathering anything 2 by 2
here.
All right. Well, thanks everybody for listening, and we'll talk to you next week.
Bye.